Welcome. Glad everyone is together. The special meeting of the Arizona Board of Regents was called to order earlier this morning before convening an executive session. As we begin today, on behalf of the board, I have a personal comment. I'd like to, on behalf of the board, extend our sincerest sympathy to the family of our dear friend, former Regent Ram Krishna, who recently passed away. To his wife, Mira, and to his two daughters, we extend our condolences and offer our prayers for your loss. He was an extraordinary guy. As we got to know him, he was a terrific orthopedic surgeon, a healer. He was a leader with an incredible array of civic achievements and awards. He was a champion on this board of higher education, and he was one of the kindest, most humble, most decent people I know I've ever met. I'm sure I speak for everyone, and I would just like to ask the board to recognize him with a moment of silence. Thank you. Of his many passions, Dr. Krishna was, of course, passionate about healthcare in the state of Arizona. He built his surgical practice in Yuma and would frequently remind us that in Yuma County, remarkable statistic, 100% of the residents in Yuma County live in a primary care shortage area, according to the Arizona Hospital and Healthcare Association. 100%. With a shortage of primary care doctors in Yuma and across rural Arizona, patients often can't see physicians for routine exams or wellness exams, let alone follow-up care after a hospital discharge. Patients often find their way back to emergency rooms for routine medical care, which of course increases healthcare costs. And worse, not being able to manage their care with a primary care physician, many discharged hospital patients become readmitted. This has become, in Arizona and around much of the country, a frightening cycle of illness and expense that too many people personally know. Healthcare shortages are not unique to rural Arizona. They exist throughout the state of Arizona. Let me share some data. 3 million Arizonans live in a community with limited access to primary care. Arizona has approximately 8 nurses per 1,000 residents, the 9th lowest nursing ratio in the country. We are in the bottom quartile per capita in the number of physicians for our population. More than 1 in 3 Arizona hospitals face critical staffing shortages. What does this mean? It means longer wait times for patients, it means difficulty getting appointments, and it means higher costs for families across our state, particularly in rural Arizona, where travel to healthcare can be challenging. And that's why today and through the course of the last few months and the next few months, the Arizona University System and the Board of Regents have set out to address our state's long-term needs with a new plan, Arizona Healthy Tomorrow. We are in the workforce business, and we are going to meet this challenge. Our 3 goals are as follows. Number 1, to reach the national average in terms of doctors and nurses per capita. Number 2, to enhance Arizona's competitiveness in the biosciences and life sciences. And 3, to improve healthcare access and outcomes with lower costs for Arizonans. This plan includes major growth and major investment from each of our state's public universities. It includes significant partnerships with the private sector, and it will inevitably include the support of state government. In April, at our meeting in Tucson, President Robbins shared his vision to support the new plan. The University of Arizona and its partner, Banner Health, are forging the College of Medicine and Banner University Medical Center into a fully integrated academic medical center, which brings together nationally recognized researchers with clinicians of national distinction. The result will be a higher standard of care for Arizonans and increased volume of medical students and graduates serving our communities and our state. U of A and Banner will also leverage its extensive rural healthcare network as well as telemedicine to make sure that these healthcare access is provided throughout our state. Northern Arizona University, meanwhile, is a national leader in nursing and allied health programs, will play a vital role in driving this initiative, especially in rural Arizona. This fall, the board will look forward to a presentation from President Cruz Rivera on how NAU plans to grow its programs in these vital workforce areas. Today, we will hear from ASU. We will hear from President Crow on how ASU is positioned to address the healthcare shortage crisis that we face. And while there are many components to the ASU health strategy, the boldest is that the Arizona Board of Regents has tasked ASU with developing a new medical school in Maricopa County. Our goal is to have medical schools operated by both UArizona and ASU to dramatically increase doctors, nurses, and allied health professionals through the combined efforts of all three universities. This is the kind of comprehensive effort that is necessary to meet the healthcare needs of our growing state while helping Arizona to ascend to a nationally, globally recognized hub of bioscience and research. It is an exciting day, an important day, and we are out to meet our responsibilities to the state of Arizona. President Crow, I'd like to turn it over to you. You can share with us the details of ASU Health.
Thank you, Chair Duvall, and I welcome this opportunity to have an opportunity to walk through our overall strategy, responding to the request of the Regents. I'll give a few preparatory comments contextualizing sort of where we are. Almost 21 years ago to the day, July 1st, 2002, I had lunch in Tucson with then Regent Jack Jewett. And at that conversation, we talked about the evolution of ASU, and the conversation about starting a medical school at ASU came up, and I said, no, not now, we're not ready. We hadn't yet evolved to the point where we could help to create the kind of medical school that would be representative of a transdisciplinary university that was evolving in the late 20th, early 21st century. That is perhaps different than the medical schools of the past. Not that they're not fantastic, it's just that they are necessary but insufficient in their design. And so I said to him at that time, what we would do was going to focus on the evolutionary acceleration of ASU. We were going to hope to take what some of our competitor institutions like Columbia or Harvard or others that were hundreds of years old and compress 200 years of evolution into 20 years. And that at the end of the 20 years, we would have a world-class research university, which we do. At the end of the 20 years, we would have a disciplinary matrix different than the standard university through a series of transdisciplinary schools. And at the end of the 20 years, we would be capable of dealing with large-scale complexity through an innovation approach that was conceptual at the time and has proven to be practical and implementable and successful now 21 years later. A very famous, currently serving university president of public universities and private universities said to me once along the way that, you know, I had become the president of ASU, and he said, you have an easy path to making ASU a world-class university. You have to do two things. The first thing you have to do is cut out the bottom half of your freshman class. Please cut out the B students, go with only A students, and you'll be shocked at how your reputation will increase markedly and immediately. And I said, well, we won't be doing that. And he says, well, then there might be something wrong with you. And I said, I'm sure of that. And the second thing he said that you need to do is start a medical school. And that when you start a medical school, the reputation of the university will accelerate more quickly. You'll be able to drive your research enterprise more quickly. You'll be able to evolve your institution more quickly. And I said, we're definitively not ready for that. We first have to figure out how to focus on a new kind of engineering, a new kind of science, a new kind of transdisciplinary science, a new kind of interdisciplinary approach to things, and a new model for the university. So we needed to do that first. And so I believe, and I think the Regents ad nauseum hear often enough from me and from us to have some sense that we've achieved those things. We have a world-class research university. We have an identity as an innovative university. We have a technological platform. We have the ability to scale. We have all of these things, which then puts us in the position of being able to advance the design of how we would respond to Arizona's healthcare needs as this new kind of university that we've built. Again, this is not diminishing anything that's going on, all necessary and important, but our approach is somewhat differentiated. So let me just comment a little bit about that because it will be reflective in the specific projects that we are announcing the launch of today, and that is the ASU design. One key element of that design is something that we call intellectual fusion, and what we mean by that is that we think that rigid, structured, hard-bodied disciplines are not the only way to go. They are a necessary way to go. They're not the only way to go. So in our case, the board has, over the last 20 years, allowed us to eliminate more than 80 departments, schools, and colleges. And you have allowed us to create more than 35 new departments, schools, and colleges. Our College of Global Futures, with its 4 strangely named schools, the School of Sustainability, the School for Complex Adaptive Systems, the School for the Future of the Oceans, and the School for the Future of Innovation, this board over time has been unbelievably supportive of our intellectual fusion approach to things, our elimination of departments like geology and anthropology, and the building of the School for Human Evolution and Social Change, and the building of the School for Earth and Space Exploration, the elimination of history and philosophy and religious studies as separate departments, and the combining of those schools into a new thing. That kind of approach is the method that we're taking from an intellectual perspective. So from an intellectual perspective, whatever we propose to you today will be anything other than just the traditional model for a medical school or the other schools that we're proposing today, so intellectual fusion. Second, we have, as you know, altered the design of the university so that we are most interested in the success of our students. Secondly, most interested in the success of our community, meaning measuring our success against the success of the community. And thirdly, interested in the success of our faculty. Not that we're not interested in the success of our faculty, but we're here to serve the community. We're not here to serve the faculty. And so one of the things that happens, and I used to be the chief research officer at Columbia University for more than a decade, and in that job was intimately engaged with the very significant Columbia Presbyterian Medical Center and the Columbia Medical School, and all the other things that were going on there. That was a more traditionally designed medical school with traditional departments, traditional silos, traditional culture, and so forth. We have been evolving for more than 2 decades a differentiated design modality in which the outcome of the community is the measurement of our success, very much in line with the charge that the chair has given, the vice chair has given in terms of why we're doing all of this. And then the last thing that I would add in terms of a design parameter that's essential to us is this notion of accelerated and continuous innovation. So if you really want to affect healthcare outcomes in Arizona, it's not only how many nurses do you produce, or how many physicians do you produce, or how many public health technology specialists do you produce, but it's also, can you educate the entire population on how to lead, get onto pathways for more healthy outcomes. Obviously, we have high levels of ignorance, high levels of uninformed individuals, people trying to sort out all the information that's available on the internet, people trying to make life choices, and so forth and so on. How do you do all of that? How do you educate people? So the third design parameter that is central to the way that we're evolving the design ideas that you're going to see today is continuous innovation, and then I would add to that the use of technology in everything that we do. How we reach the public, how we would deal with public health issues, how we would design the medical school, how we would produce physicians, for instance, that might be, I don't want to think of them as superhumans, but more like Dr. McCoy. And what I mean by that is some kind of little device and instrument and tool and other kinds of things that go beyond just traditional medicine and go into the notion of social scale medicine in addition to traditional medicine. So, having said all of that, the ABOR request to us as the governing board of the 3 public universities is, are you ready to up your game? We need ASU to move to the front line of Arizona's health outcomes. Not that we haven't been there with our tremendously and significantly performing Edson School for Nursing and Health Innovation, or our College of Health Solutions, which between them have 10,000 students. Our department focused on health systems engineering in the Fulton Schools of Engineering, our programs in public health that are in the business school and in the School for Human Evolution and Social Change. It's not as if we don't have things. And on top of that, from a research perspective, we're one of the top 10 research universities in the country with funding from the National Institutes of Health that doesn't have a medical school. So us and MIT and Berkeley and Princeton are the schools that are in that particular group. So we have high-performing research scholars also. The board has also been allowed us to evolve the Biodesign Institute, which sits as one of the most significant institutes of its type in the country. In the biosciences, we now have a biosciences incubator on the Phoenix Bioscience Core area in downtown Phoenix. We have other things that are going on. So we're not the things that we're proposing, particularly for people that are listening that might not be aware of where we are. We're approaching this request from the board from the perspective of substantial strength, research strength, education strength, innovation strength, educational program strength, experience. I'll just take nursing as an example. So the Edson School for Nursing and Health Innovation is one of the largest nursing schools in the country. We're producing large numbers of BSN RNs. We're producing very large numbers of MSNs, very large numbers of nurse practitioner doctorates. We have a number of programs there. The challenge that we have there is how do you go from already being a very significant performer to being a hyper performer, one of the largest producers of nurses in the country, to a much larger producer of nurses in the country. Well, that's through innovation, technologies, partnerships, alignments, and so forth. And so the request that came from the board, what I feel good about is we have the means to respond. We have the tools, the team, the mechanisms, the insights, the perspective, and the experience in both education, research, and outreach to the public. 20 years ago, we didn't have any of those things. We didn't have any of those things. We do now. And so the proposal that we're about to put on the table is one which I have very high confidence will be successful, very high confidence that the university will accelerate its evolution. We're moving at a time of 10 times the normal speed, so 200 years of evolution in 20 years. And we're going to have to accelerate that a bit more because of the timeliness of the needs of the public. So let me introduce the team that's been working for some time on this project. I'll start to my left with Morgan Olson, the university's Executive Vice President and Chief Financial Officer, who is working with us from his own experience as the former CFO at Purdue University, the former head of NACUBO, and building the kinds of models that we will need to advance this, because this is going to be advanced with a range of investors, private sector partners, public sector investors, university investments, and so forth and so on. And so Morgan's been involved from the beginning in helping us to make the designs that we're now working to now begin implement. And then Maria Anguiano, who's our Executive Vice President for Learning Enterprise. And Maria is on point with her startup staff of 120 people, focusing on a range of things about gaining more access to learning outcomes and learning tools from the general public. She'll be focused on the building of the public communication asset that we have. And then Dr. Shireen Gabriel, who's ASU University professor and our senior advisor on all things medical. She's the former president of Rush University in Chicago with its medical school and other schools, as well as the dean of the Rutgers University Medical School and the Mayo Medical School, as a member of the National Academy of Medicine, and has been working with us intimately in our team, in our group, to bring the expertise. She's also visited the prototype that we think we have for the medical school proposal that we're going to be making, and we can talk about that in a second, and made an assessment of that. And then Nancy Gonzalez, who is the university's Executive Vice President, Chief of our Academic Enterprise, and Provost of the university. So the 20 colleges of ASU, the 250 degree programs of the university, there'll be at least 4 or 5 colleges that will be involved in launching these schools. We're planning on launching these schools not by building from whole cloth and appointing all new people, but by drawing from the faculty that we have, drawing from the expertise that we have, and building a networked version, a matrixed version of the schools that we're talking about, which will allow us to accelerate more quickly. Chris Howard, who's the ASU Public Enterprise Chief Operating Officer and has been involved in all aspects of this project and its design, and brings his own experience as a former university president to the table. And Sally Morton, who is our EVP and head of the Knowledge Enterprise. For those of you that might think that these things come out of the head of the madman in room 410 of this building, that would be me. No. They might get started there, but they never get very far. And so this team has been working on this idea as well as with others. So let me get to the specifics of where we're headed. So first, and this is really important, looking at the slides that are behind me, ASU Health is the name that we are selecting for what we will call the creature that ASU will establish. There are a number of universities that have such a name: UCLA Health, UCSD Health, et cetera, et cetera, et cetera. In those cases, those are large hospital organizations, healthcare organizations with clinics and so forth and so on. Our approach is different. Yes, we will have a medical school. Yes, we will have a public health technology school. Yes, we'll have expansion of other schools. But our approach to health is at the social scale. How do we take and address Arizona's health needs along the way? And so what is ASU Health? ASU Health will be a new structural entity within ASU, coordinating among and between the various colleges to build the new things we need to build, and then to coordinate and evolve our direct connection to the public. So we call it a learning health ecosystem. I apologize to the board for such academic-oriented phraseology, but what it means is one of our problems relative to health outcomes is bringing the public along with us. We can build every tool that we want. In fact, the United States should be noted as having the most advanced biomedical technologies that have ever put in place. We have unbelievable expenditures in the United States. We rank first in expenditures per capita on healthcare, and we rank somewhere below 25th in terms of the outcomes of those expenditures, in terms of lifespan and healthy lifespan outcomes and so forth and so on. So what we're missing in all of these things, we think, is a learning environment that's also operating at a social scale. So ASU Health is a learning health ecosystem designed to accelerate and grow our health-related efforts in response to Arizona's current and future healthcare needs. That's different than just the design of a medical school. What will we do? What will ASU Health do? We'll increase the number of healthcare professionals. We'll expand access to quality healthcare, and there's lots of ways to do that. Quality healthcare doesn't mean only showing up to the doctor's office. Quality healthcare means having an unbelievable decision assistant that understands you individually as a person and is helping you to make decisions each and every day in your life about your nutrition, your medical status, your symptoms, all these kinds of things. And so think of this in a broader contextualization. We will work to improve health outcomes and expand research. We believe with this accelerated activity, this will vault us over $1 billion a year of research expenditures, move us into the top ranks of the biomedical research organizations, particularly when you think about this in the context of social impact and social scale impact and med tech technologies and learning technologies and physicians being involved in health outcomes in not just hospital or clinic environments. We will provide professional healthcare training and upskilling throughout the entire population. And really, really importantly, because we can see this in the data for Arizona, we'll focus on health literacy. How do we get people to understand what they're listening to? How do you make decisions about where you are and what to do and how to take advantage of different kinds of things? So those are our objectives. Why does Arizona need ASU Health? Well, not only because the regents have asked us to do it. That's a good reason. Yes, that is always an important reason. And so, as the regents know, I listen carefully and process slowly. And so, but we are making progress. And so, I'll just quickly go through this. We don't do well in terms of our healthcare system performance. We're underperforming. There's lots of reasons for that. And so the best thing is to embrace that and to say, okay, how do we change that? How do we move that forward? We have a hospital bed shortage. That is, we've got shortages of workers, shortages of places to go, and we have health care outcomes we have to work on. This is, we're ranking low among public health funding. Well, it's not time to bemoan that. There's all kinds of reasons for that. It might not even be the best indicator. What is a good indicator is how do we increase our health outcomes, our public health outcomes, by perhaps using a model which doesn't require as much money. By using a model, this has been our approach to public education also. We need more doctors. We've already talked about that, and Regent Duvall has discussed that. We have an even more acute nursing shortage, and so I'm not going to walk through everything that we're going to do, all aspects of ASU Health, because we have an entire book of 9, 10, or 11 major initiatives. I'm going to focus on those initiatives which are the most challenging, the most, I think, important to the evolution of Arizona and the evolution of ASU. And so what will we do? How will we help? How will ASU Health help? And ASU Health, again, is the nomenclature, the design for this entity within ASU that we will be creating. First, we will conceptualize, which we're at the earliest stages of conceptualization now. We will conceptualize, design, and launch a School of Medicine and Advanced Medical Engineering. Now, there are 2 of these in the United States right now, one at the University of Illinois and one at Texas A&M. And why are we selecting this as our particular method? We think that the graduates of this school, so enhanced by their dual educational outcome, an engineering outcome and a medical school outcome education at the same time, will be able to add a mix to Arizona that will be beneficial to the ultimate design of the Arizona health system. I'm going to ask Shireen to just comment on the trip that you made to the University of Illinois and just give a sense of what they've been able to do at Urbana-Champaign. So, Dr. Gabriel.
So thank you. I'll be brief, but University of Illinois and the Carly Health System have been able to create a very unique medical school that's really almost an outgrowth of their School of Engineering. Their School of Engineering, their College of Engineering is one of the very best in the country. They have many relationships with and similarities with our colleges of engineering. Engineering really has partnered with the health assets of University of Illinois to create this school. Many of the faculty of the school come from engineering, so the faculty is different, the curriculum is different. The students, they recruit sort of a different kind of student who has aptitude and background in engineering. And when I met with some of those students, always the most fascinating meetings when you visit anywhere is meeting with the students. It was just fascinating to hear not only their backgrounds, but what they propose to do. And so to graduate from that school, for example, it's important, each student must have a project that includes an engineering theme, a business theme, as well as, of course, a biomedical theme, all focused on a particular health problem and coming up with creative solutions. So, you know, as President Crow said, the hope is for these students to come up with different kinds of solutions for our health problems and advance health in those ways. So it's a very creative school, and I think we can do something even better here.
Right, so just to contextualize, so Regents will recall that ASU is now running the largest engineering school in the country with 30,000 students, 22,000 on campus, 8,000 online. We're launching 3 new engineering schools as we speak, one which is up and running, Advanced Manufacturing and Network Engineering, a new facility that will go to the Regents for consideration for construction on the Polytechnic campus, and then the Regents recently approved the new engineering school on the West Campus that we have that's evolving. We don't know exactly where this will fit in, but the notion would be, by the way, that if you're not an engineer when you enter this medical school, you're an engineer when you leave it. And you'd say, well, how is that possible? And this goes to the way that we've been doing things. So we have added to our on-campus engineering cadre from 6,000 students just a few years ago to 22,000 students by finding ways to empower people to become engineers who would normally not necessarily have that pathway. So we figured that out in our innovation environment that we've created. So I'm going to ask Provost Gonzalez to comment on the notion of just the way that the faculty are working together and how we can bring people together. And what I want to say to the Regents and to others that might be listening is, please forget the way that most universities work. We work in a different way, not better, not worse, different. And what I mean by different is that our faculty can actually work together. So just talk about a little bit, Nancy, about how we would, launching this, everybody's laughing, it's how we, in launching this, we would build from the faculty that we have. Oh, first, Shireen, how many people did the medical school initially hire at the University of Illinois to get going?
I think 2. So they really built from what they had.
Yeah, so just how would we do that here, just for the reason?
So we already have strong faculty in biomedical engineering who even independently have been thinking about how they might partner better in medical school training, and they've been in conversations even with the Mayo Clinic about this. So we have the capacity to take the talent already there. We'll probably, and to partner with other people across other colleges. We've got the infrastructure and the kind of the DNA to do interdisciplinary work, both within schools and across colleges. And so we plan to deploy all of that learning that we've developed over the last 20 years about how to do that kind of work to build this very different type of medical school. We think we're an ideal place to do that. And we don't anticipate needing to hire a lot of faculty at the outset to get this up and running. Currently, our School of Life Sciences and faculty, for example, teach courses for the Creighton Medical School and for other institutions. So we already have some basic medical training in place that we can deploy in different ways.
So let me further contextualize the design trajectory that we've selected for this School of Medicine and Advanced Medical Engineering. So in launching this now, we are now a world-class research university performing at the level of MIT or UC Berkeley in terms of our volume of research without a medical school. We are that now. So that university, us, with the largest engineering school in the country, with the schools that we have, with the nursing college that we have, with the other schools that we have at ASU, with the Biodesign Institute, we're now entering this moment from a position of unbelievable strength, from which then this new design we think will become a prototype for a new kind of medical school. And what I mean by that is we think that what we are going to do is try to augment the field of medical schools that are out there by this new design and this new approach. That would have all been gibberish if we had said that 20 years ago. Fluff. There's no fluff. This is going to be a world-class medical school taking an engineering orientation and producing a new kind of physician engineer, and using this physician engineer in ways in the marketplace for the need for healthcare outcomes in new and powerful ways. Now, if you thought that's all we're going to do, well, that would be an error, because we're also going to launch a School of Public Health Technology, which is different than a School of Public Health. Now, this particular idea comes from the broader community of scholars and thinkers and public health professionals that are out there that have for some time suggested that in the mix of schools that are out there, the public health schools that are out there, there's a need for some of those schools to take intensely technologically focused approaches to public health outcomes. The uses of data, the uses of wearable devices, the use of advanced wastewater analysis systems, early warning systems, lots of things that are going on, but not in a focused way. And so in this particular case, we've already brought together a group of national experts. Susan Blumenthal, the former Assistant Surgeon General, Admiral Blumenthal, was our co-chair of advancing this project with Malcolm Grant, the former head of the health system, National Health System of England. We brought these people together and we've designed this school. We're further along with this school than we are with the medical school, and we will be finding ways to launch this school as soon as possible. I'm going to ask maybe Dr. Morton, who was a part of the process of putting this school together, what does this make you think about in terms of what we're trying to do from the knowledge enterprise perspective?
Sure.
And I'll also add that Sally was a chaired professor in the University of Pittsburgh's medical school, has been involved in biostatistics her entire career, and brings that expertise to the table also.
So thank you, President Crowe. So you've really emphasized the education in this public health technology domain, but two other aspects that we've talked about are both research. Obviously, what are the questions here? What research do we need to do to further them? But also innovation. What does a tech accelerator look like in this setting? What are the business models to move public health technology forward? And that is something that ASU obviously is an expert at.
How could we get more concentrated industrial development around public health technology here in Arizona? As one of the remits from the board is you're also looking for enhanced industrial development in Arizona around these industries that could come from these things. And so we've designed this from that perspective. Anything else? So this school, again, would be one that draws from some of the faculty that we have, some faculty that we would hire, would operate at the modality of this intellectual fusion space that ASU has become very experienced at making these things happen. A third thing, again, I'm not walking you through all the things that we will do, is the ASU Medical Masters Institute. This is a one-year MS program for people that already have medical degrees that are looking for placement, looking for additional education, and what we're after here is ways to attract more physicians to Arizona. So the Medical Masters Institute would give these degrees, for instance, in public health technology, would give a master's in medical engineering and design, would give a master's in observational sciences, but it would attract MDs here, and then we would build an alliance with other healthcare providers so that they could be deeply engaged in looking at these students that come from these medical schools as ways to, as a different pathway. Would any of the team like to comment on this?
Well, I'll say something. I think that now more than ever, senior medical students even, as well as individuals who already have master's degrees or people who are early mid-career in medicine are looking for ways to upskill, because it's become clear that whether it's technology, public health technology, engineering, there are all these new skills and disciplines that are bearing on medicine that they don't know anything about. So we believe if we offer these short one-year degrees to these kinds of individuals, we'll have a whole cadre of physicians or senior medical students that have now a connection to ASU and a connection to Arizona that hopefully will attract them here.
That's the objective. The objective is to get more docs into Arizona, and there's all kinds of things that all of the universities could be doing to help that to happen other than just producing them. Our relationship with Mayo and the Mayo ASU Healthcare Alliance continues in all of this and accelerates. This is a picture, the buildings to the left, just to the right of the 101 right there. That's the Mayo Hospital to the far right. All of that in the middle is the Discovery Oasis, which is one of the 7 innovation campuses that ASU is a part of in the Valley. The ASU Research Park is an innovation campus. The Novus Corridor is an innovation campus. SkySong is an innovation campus. This Discovery Oasis is an innovation campus. We have one facility built on this site. We have a relationship with the Mayo Clinic. This relationship continues in all ways, from a research perspective, from a partnership perspective, and so forth. They have their own medical school. They're advancing their own medical school. We're working with them on those things. This is just to illustrate that this will continue. And you can see the scale of that piece of property there, which has been purchased by Mayo. And I think the first tenancies are advancing rapidly on that site. I'm trying to give a sense also of the fact that we're not abandoning the foundations on which we're resting. And then the last of the things that I will mention that we will be initiating is the Arizona Health Observatory. Observatory is a kind of a strange word, but it means, how do you gather information to make better and early warning assessments of the condition of the public health status of people in Arizona. So for instance, we are able to use wastewater right now to detect any of dozens and dozens and dozens of pathogens, viruses and other things, as well as drug use and other kinds of socially complicated things through our laboratory focused on solid waste assessment. This would be a great and tremendous expansion of that. This would be basically things that we learned during the pandemic, ways in which we can make better decisions, ways in which we could produce better health outcomes. I'll give you an example. So in Arizona, asthma is a leading contributor to underperformance for kids in elementary school. What could we do to be monitoring the dust load of the local environment, the particular wind conditions, et cetera, et cetera, et cetera, to help through a health observatory to get better educational outcomes for people afflicted with asthma, just as a simple example. So, Regent Duvall, we have a few minutes that we can just deal with comments and questions. What I will say relative to process, the process here is one of accelerating the design activities we've already been in. This public blessing by the board, this public assignment now for everybody to be aware of, that ASU will be conceptualizing, designing, and launching a medical school. We will be conceptualizing, designing, and launching a public health technology school. We will be conceptualizing and designing an Arizona Health Observatory. We will then be building the Masters Institute that we mentioned here. And then other things that we will also do, just to be clear, are we will be working to triple the number of nurses that we are producing, which is no small feat, I have to tell you. We'll be looking to expand the research activity of our College of Health Solutions by 5x. And so that's a huge undertaking that we're taking in the middle of all of this. We'll be launching, in fact, Maria, you might want to comment, we'll be launching this health literacy program. Just mention a couple of the things involved with that.
Yeah, so one of the things we're looking into is basically short bites of helping people take in health literacy. It's a very difficult subject. So by creating small short form videos of a way to really upskill people in their own health literacy, 5 minutes at a time. So that's one tiny example, but we're thinking differently and working with lots of different partners on, how to really create it as a more long-term nudge type ability for people to learn about health literacy.
So ASU Health will be this entity that's performing all of these functions going forward. We'll be back to the regents with obviously the details as required by regents policy for the launching of new schools, the launching of new buildings, the design of new programs, the advancement of new degrees, all these things. You can see some brief pictures of the kinds of things that we were just talking about, all in the spirit of our charter. And so, Regent Duvall, that is our presentation. We're open for comments.
Sure. Thank you, Mr. President. Any comments from regents before have a short close, and then we'll take questions from the press. Regent Herbold.
A brief outline of the timetable would be helpful.
I knew you would ask that. For public health, what I can say is that with this meeting, we will go into a ramp up mode in terms of expanding our design, conceptualization, and implementation staff, which is to then leverage the other staff that we have. That'll be immediate. We will begin the process of basically working to launch the public health technology school as soon as we can configure that. The medical accreditation processes are cumbersome, as Dr. Robbins and Dr. Gabriel are fully aware. That's not an overnight kind of thing. So we will work to design the medical school immediately and hope that we can launch it in the shortest time frame possible. We have to think through, we're already launching and designing our fundraising activities, our partnership activities. We are in discussions with major national healthcare organizations who might partner with us and invest in what we're doing. We're working on all of those things. We are already launching the health literacy design program that's underway. So it's an immediate thing. Some things will be rate limited by process. Some things will be rate limited by acquisition of people, but everything's in real time.
Comments or questions?
Any other comments by the team, Sally?
Yeah, I would say that the Arizona Health Observatory is already well underway. You need that evidence scaffolding, as it were, to know what is happening, what impact we should have. We already have $20 million worth of funding on various projects that underlie the observatory. It's important to have that out in front.
Yeah.
Otherwise, you don't know what's going on.
Right. So that's a function of we have to find some leadership folks to run these things and advance these things. We have other advisors and counselors that we're bringing in to help us to make the right kinds of decisions. The exciting thing for me in this, and President Robbins could perhaps comment on this, it usually isn't the case that what we've become as a very significant research university then decides to do a medical school. I think UT Austin would be the last example of that. Usually in lots of places, they're just trying to build medical schools where they can get them going, and the university may be evolved, it may not be evolved. And so what I want to do is I want to be very, very deliberate about drawing from the foundations that we already have, which means, by the way, that we should be able to move at a somewhat more accelerated fashion.
Michael. Yeah, I'll also say we've been actively designing the School of Public Health and expect that you'll.
Public health technology.
So it's public health technology, sorry. And we expect you'll be seeing documents on that for consideration for early fall.
Yes.
So I was just going to add with respect to the ASU Medical Masters Institute, we already have, and Nancy will correct me, something on the order of 100 master's programs that exist that will be maybe adapted slightly and live there, in addition to the new ones that you talked about,
Right.
public health technology, engineering, so on.
So one of the advantages we have with 5,600 faculty members and 25,000 support staff and 250 degree programs, or hundreds of degree programs, 250 programs, departments in school, is that we have a lot to work with. And if you're organized, in fact, you'll laugh at this, but this group's actual working name out of my office is Working Group Matrix. And the
Feels
reason
like
for
that,
that,
too.
It feels like that too.
Yeah.
We're in the matrix.
yeah, and so the matrix, and we have an advantage in the matrix, which allows us to move in an accelerated fashion. I will say, we don't know yet how long or the exact process of the accreditation environments. Shireen, you might want to comment, having been dean
Yeah.
or president once and dean twice. I mean,
Yeah, I mean, it varies. I mean, it can be 2 to 3 years. It can be something a little more than 1 year. And the good news is, many of us have connections with these accrediting bodies. We've already kind of had very, very, very preliminary conversations about what it would take, and we can engage with them as soon as possible and move things forward. So I think really that's the key, is engaging them early, but yeah, it can be a prolonged process, and we hope to prevent that.
Sure. Regent Herbold?
What other schools are pursuing this kind of thinking? And have already implemented some of it. You've mentioned Illinois.
well, there are elements of this. So the public health technology school idea, we're first out of the blocks on that, and we drew from expertise from all the other schools, as well as just describe who was at the meeting that we had on public health technology, Sally.
Well, the then head of the CDC as one example of the sorts of people, entrepreneurs, a woman who is running one of the first wastewater surveillance companies that grew out of the pandemic. So there were people from Google Health and so on. So a wide array of folks coming together and saying, this is what is needed now.
And we'll get the regents, the report that was produced by that group. So in that case, we're at the point and we're drawing from others. In the case of the engineering school, we think there's two, Texas A&M and University of Illinois. We haven't had a chance to visit Texas A&M yet, but we're in contact with them. And so we're going to look at that, draw from them, draw from their expertise. There's really nobody that's taking our particular approach. Dr. Gabriel or Dr. Robbins could comment on that, being physicians themselves and being involved in, substantial medical schools. Our view of health would be so UCLA Health, which is a big hospital and clinics and so forth and so on, would be very different than ASU Health, but you would expect that anyway. We have in our plan the conceptualization of clinics, but our clinics would be led by nurse practitioners. And they would be operating in a different modality than traditional urgent care clinics that are operating out there. So I don't think there's anybody quite with where we are. Shireen, do you want to comment on that? Or Bobby, do you want to comment?
That was going to be my response. I don't think there's anybody quite where we are. There are certainly things to learn from others, and they have some things maybe to learn from us, especially the UI school and Texas A&M engineering branch of their medical school.
So those are both world-class engineering schools, both of those. Both of them are very large engineering schools. And both of them have our approach will be slightly different. So they probably require you to be an engineer to be admitted. We will make you an engineer once you're admitted, if you're not already an engineer. And that's easier to do now. And we have ways to do that we've pioneered and developed here.
Excellent. Regent Penley?
President Crow, I just think this is enormously exciting. I think you've really elaborated very effectively on what I understood the board asked you to do as one regent. And I think it's a very exciting proposal. And like Regent Herbold, I look forward to understanding the timeline a little better and knowing how quickly we can realize the benefits that you've described. Certainly, you've demonstrated how much a university can really address the needs of a community and address the needs of the state, in this case, Arizona, and what we really need. You've mentioned a great deal how ASU has reached this point and enabled itself to do so. You've talked to some extent about the changes that are going to occur to ASU with the expansion of these programs. I'm a bit curious about the scholarship and Dr. Morton's role in this, because even though ASU has become a premier research university, I'm anticipating that what we're going to see is that accelerated rather tremendously. So a comment or two from you or Dr. Morton?
I'll give a few comments and then Sally can comment, and it goes like this. And so we already, as a part of our evolution as a research university, have a lot going on in the biomedical space because of biodesign and other things that we've got going on. Our nursing research intensity is not where we would like it to be, so we're going to be looking to expand that and intensify that. Our nutrition research intensity is not where we'd like that to be, so we're going to be upscaling areas that we are not performing at the level that we would like to from a research perspective. That's not easy given the level of educational scale that we pursue things. The health observatory will be an accelerated new research area, the public health technology school, but also as a part of all this, we'll be looking to augment our faculty in biodesign, in the sciences, and in engineering, and in related areas of augmented intelligence, artificial intelligence, social sciences, behavioral sciences, and so forth. So maybe Sally and then also Nancy can comment on this.
Well, I would only add, because we're sort of de novo starting this, it's an opportunity to look at what has worked elsewhere and what hasn't worked as we set up the data infrastructure and other infrastructure that will support research in this space, for example, clinical testing sites, data collection, and so on. There's an opportunity, again, to learn, avoid pitfalls, and do it really with, as we've said, deliberate speed. I think it's also really exciting to think about the connections from clinical medicine to public health. In a lot of settings, those are very siloed. They have their own cultures. They don't talk across each other. And now is really a time with a focus on community to make sure those are working together.
One of the things that we see happening, and so Josh LeBaire also holds the Virginia Piper Memorial Trust chair in personalized medicine. He's also the director of our Biodesign Institute. And so an area that we have not been able to fully capitalize on is something that the artificial intelligence systems, which in all likelihood will not destroy our civilization, as some people said yesterday. I just think there's probably a limited chance of that. And so we're really advancing under the assumption that there's things to be had from those technologies. And one of them is unbelievable enhancements in personalized medicine. So we have an ability to understand your genome or the genome of your ailment or the genome of your cancer. And when we understand those three things and can computationally express that information in real time relative to your physician or your medical care analyst that's working with you, we think that all things enhance around that. That then is for us unbelievable acceleration in research related to personalized medicine in particular, that would be driven by data derived from things like these wearable devices that people have, as well as some genetic understanding of who we are individually, biomedically. Then connecting those things together, we just think that that's a very, very powerful and fruitful area of research that we're going to be well positioned. There's a lot of groups out there doing this stuff, but we're going to be well positioned to deploying it at social scale. That's really what we're focused on.
President, can I just add one thing? It's a kind of corollary to what Regent Penley said. So the research and the scholarship critically important. As someone who's been there for about a year, the reputation of Arizona State University as an ecosystem of innovation attracts a lot of people. This behind the president is going to double down on that. It's going to be 3x, 4x. I just want to make one example of the commercialization and the revenue, the money part, the things that Morgan and I think about quite often is that I think this ecosystem is going to grow exponentially. Example, connecting with someone who came up in the, Sally was at Pitt. I ran Robert Morris University in Pittsburgh, was on the board of St. Clair Hospital, which is part of the Mayo Clinic Alliance. A company that launched out of Pittsburgh, went to Silicon Valley, a bioinformatics company, sent their kids to school here, and then moved their whole operation here. Good manufacturing practices and bioinformatics, doing quite well, connected them with our dean of our School of Global Health Solutions, Deb Hurlitzer. I think you're going to see more of that. You're going to see more attraction of that virtuous cycle of companies that want to be in this bedside, bench to bedside. And I think there's concomitants and unforeseen things going to be very positive because we already have this beacon around innovation. It's just going to continue to bring things in. That's one example.
Dr. Crow, I'd just bring up linkage. Looking at these various approaches, I know well-studied, thoroughly looked at capabilities, and certainly when you look at these and how these will link together, we talked about the team of Matrix here. There is some great linkage here. I also would like to just compliment you, Dr. Cruz Rivera and Dr. Rotmans, for embracing for the state of Arizona the power of your 3 universities to look at healthcare differently for the state of Arizona and all the things that you outlined and Dr. Robbins outlined in his announcement. I think the working together of these 3 universities to come up with individual but collectively good outcomes for the state of Arizona, we're on the right track, and it's been long overdue. But to answer the challenge in a way that you all have is exciting because it's about today and today's announcement, but it's about the tangible, the outcomes, the private enterprise connections, the opportunities to move so many of these programs forward for so many different citizens in this state, both in large counties and very rural counties. I think it's a very exciting moment for the state of Arizona. I want to compliment all of you for the work done to this moment. I think we're on something.
Well, apropos of that, we have always operated under the assumption of partner, work with others, and that's still our strategy going forward, as opposed to some institutions around the country that have difficulty, in their competitive arenas. We don't have those kinds of competitive issues, beyond sports, and so that's which is important. But in the other arenas, we're able to work together. So,
Okay, well done.
Thank you.
Just-
Regent Pacheco.
And I just want to expand on what Regent Foster and what Dr. Howard was saying. This is a broader economic development play for Arizona. There's incredible connectivity, and it's going to bring benefit to everyone in Arizona within health and outside of it, from jobs and manufacturing and expanded opportunity across the board. So I'm really excited. Thank you for all your efforts.
thank you.
Thank you all. I want to close, and then it would take a few minutes to take any questions we would have from the press. But want to reinforce what's been said by fellow regents. This, much like President Robbins did in Tucson, this meets the moment, it meets the need. I think it's important that we see this in the context of this statewide plan, Arizona Healthy Tomorrow. This is step 2. We will have step 3 in Flagstaff at NAU. And it really reflects, I think, 2 important themes. The first, this is the regents and the presidents and the universities taking responsibility for the public health outcomes of our citizens. That is the thematic objective of this initiative. Number 2, notwithstanding, to use your phrase, President Crow, to further contextualize the history, not 20 years, but 60 years ago, at this June meeting, the Board of Regents made the painful, difficult, controversial decision as to where to place the medical school. It really was, at the time, for reasons which the president has said, an obvious decision that it should go to the university with the strong basic sciences. But for that decision, I would have been raised in Phoenix rather than in Tucson. But the important point was that at that meeting, which I've gone back to reread the history of it, it was expressly noted that the growth trajectory of Phoenix would inevitably result, and the growth of ASU would inevitably result, that there would be an ASU medical school. Now, 60 years later,
We got a law school out of that.
for which I was the beneficiary, ironically. So this doesn't just meet the moment, but this moment has been a long time coming. I also have some announcements that the regents have dedicated $30 million of TRIF dollars to the healthcare initiative at all 3 universities to help them plan, help them assess the data, help them do what they need to do to bring us more mature plans. And I'm excited and very pleased to announce that Governor Hobbs has released $15 million in furtherance of the board's 5-year plan, of which the healthcare strategy is certainly the premier component. So this is an exciting moment. It's one with a lot of momentum, a lot of acceleration, a lot of enthusiasm, but it is meeting the needs that our state has assigned to us. And for that, I'm grateful, President Crow, for the presentation. President Robbins, for your presentation in Tucson. Looking forward to that in Flagstaff. And we're going to take a moment break for anybody that needs to step out and otherwise take some questions from the press. So let me just give a moment to anyone who wants to step out and otherwise turn it over to the back of the room. Yes.
Just a quick question. You mentioned it earlier about the need in Arizona for healthcare. What is the element that will keep folks that you graduate here in the state?
I'll comment on that. We're very successful at that now. We keep the majority of our out-of-state students end up staying in Arizona when they graduate, and those that then move away come back. So we've seen this pattern of people just want to be here. I tell everybody that we hire here, just be ready because the whole rest of your family will be moving here after they start visiting. And so we have certain natural attributes that keep people here. But I think the other thing goes to the environment that we're creating. And I think that Regent Pacheco said it correctly, that is, this is not just the launching of a medical school and a public health technology school and a health observatory. This is the further evolution of the ecosystem here, the businesses that cluster around these things. Part of our emphasis on technology is for that very reason, that we think that the technologies that will be emerging from the future of medicine are literally, given the computational tools that are now available and the visualization tools that are available and the access through the internet to information that people now have, they're unbelievable. And so the opportunities here for people to be employed here as a part of all this are accelerating. And then on top of that, I mean, obviously with this county being one of the most rapidly growing places in the country, with the state growing, this place is evolving rapidly. Arizona is evolving rapidly, and the number of opportunities and the broadening of the economy and all the things that are happening here are going to keep these people here. And then I think at the end of the day, I mean, it really is the case that if you empower and educate people in a particular way, and then they're focused on a particular social set of outcomes, they want to be a part of that. They want to be here, particularly the way that we will have medical students and public health technology students working at certain kinds of problems. So I think that's an objective. So we don't just train them and then send them off to Montana or California or wherever they might go. I think we've got a good set of tools to help keep people here and to attract people here also.
If I could add a brief comment in the context of economic development. There is a global competition for this new emerging, exciting arena of life sciences. Austin and La Jolla, and there are in Germany, there are places where the necessary cluster of capital, intellectual capital, academic leadership, clinical leadership, and cultural ambition all have created the alchemy to make a competitive energy exist to drive into that new world. Arizona starting with TGen, moving to the BBC downtown, the University of College of Medicine growing into its fullness in Tucson, what ASU has announced today. We are simply looking to accelerate the economic drivers that will enable us to create high wage growth, to create better health outcomes, to create cures, and for Arizona to be on the map of the bioscience competition.
I was just in Abu Dhabi last Thursday and met with the leadership of their new medical school that they're launching at the University of Abu Dhabi. Even the university didn't exist until very long. I mean, the whole world is accelerating on all fronts, this notion of there are ways now through the technology foundations that we have, the tools that we have, the science that we have to change life outcomes in dramatic ways around biotechnology and biomedical systems and bioinformatics systems. And so, I think that Phoenix and greater Arizona, Tucson, the state is a place where this can be accelerated to a very, very positive set of outcomes. And we already have a population which is benefiting somewhat from the outdoor nature of the place and the ability to exercise and all these other kinds of things. Now we need to ramp up our ability to create this environment for creativity and technology development and producing new kinds of doctors and new kinds of nurses, all those things.
Yes.
I've just got some questions around how much all this is going to cost. I don't think we've touched on that yet. I understand there's 30 million, obviously, from the board, and Dr. Crow mentioned that this will be funded through university investments and private sector investments as well. But is there a number on how much ASU Health is going to cost? And is there any idea from the board break how that 30 million is going to get divided between the three universities?
Well, what I'll say, and I flashing through my mind is that scene in with Mike Myers talking about $1 billion versus $1 million in some of you saw that movie and you'll remember it. And so it's more to the larger number. And so the way that this works is that the funds from the regents, funds that we have at ASU, resources that we can acquire, resources that we will put at risk, we will seed fund all of this. And then like the rest of ASU, it will find a way to fund itself. And that's the way that we've built the university. Now you have to look at how we have evolved the university. So in the year going forward, our operating revenue will exceed $5 billion. And that operating revenue will come about $400 million from the state and $4.7 billion from something else. And so what we will do here is design self-sustaining entities that require resources for design. We think we have those resources. Resources for launch. We think we have those resources. And then we'll be looking to investors. We'll be looking to private investors through foundations and philanthropy. We'll be looking to revenue that we can generate, which will be substantial. We'll be looking to possible public investment for this initiative or that initiative along the way. And so all those things are moving forward. And the key to the answer that I'm giving you is this is the way that we do things. And so we didn't like go to the legislature and say we'd like resources to help us to expand engineering from 6,000 to 30,000. That isn't how it works for us. We evolve with the board a relationship where we develop plans and strategies and resources to initiate these strategies, and then we find the resources to be successful going forward. Now, that doesn't mean that we won't, we probably won't go to the Arizona Republic asking for a contribution, but we will go to others, and that, yes, I know. And so.
Thank you for being here, by the way.
But we will be going to others, and we will secure immediately a substantial philanthropic investments to help get all this going. We already know that. We will make our own investments. And so it is a, I guess the word is, this is an entity which will follow the ASU tradition of being financed by its implementation.
Let me add to that, just a broader context.
And you're certainly going to give us all of the 30 million.
Yeah, that's right. You've raised questions which are the next phase of our discussion. We wanted to signal our commitment by making these monies available so that the universities know that we are dead serious and that they've got money to plan. So that is phase one. Phase two will require all of the things that the president has said and which President Robbins also said in Tucson. It will require private sector engagement, but require public sector engagement from our state partners, without question. But the way I would pose it is this: what is the cost of bad care? What is the cost to Arizona's families when they can't see a doctor? What's the cost when you have to drive for hours and then wait in a waiting room because there's just insufficient care? What is the cost to the system of getting your medical care in the emergency room? There are lots of costs in our healthcare system which are passed along, hidden, not accounted for, because we do not have the kind of capacity to serve the citizens that we need. And so while there will be investments required here, our real goal is to help in the costs to Arizona citizens and better care.
What the economic
Yes, and I'll refer you to the reports. Other questions? Yes.
Plan for or anticipation that the number of residency and fellowship programs within the state will increase the limits of the.
Right. This is a tough question. I'll ask either president to respond to this because they've both got a lot of history in this. This is a barrier to success that we need to try and address. So it's a great question, either one of you.
It's an area where we're gonna have to be very creative, but we may have people moving around. We may have different ways that we do this. We don't know all of the solutions to the residency component part because that's dependent on the number of hospital beds and the way that the hospital units are structured and so forth. So we're looking for creative solutions. Our scouts are out there. We're talking to everyone. We're talking to global scale, national scale healthcare organizations. Maybe we can work with them. We're visiting, large scale medical school operations beyond just the ones that we have talked to. So we're looking for solutions, and President Robbins may want to comment on that.
Yeah, I think it's obviously a major problem, just for the number of students that are graduating today. And we're talking about forced multiplication, that there are going to be many other medical students that are going to need residency slots. And that's as most people would know, where you do your last training is usually where you end up staying. So that's an important part, as you said, President Crow, to not just educate these new, I think Texas A&M calls them physicianeers or something like that.
Physicianeers.
Physicianeers.
We won't be calling ours that.
Yeah.
Sounds like a Disney term.
Doctor ears. Yes. So this is a major issue, and that's why we have to work together with the hospital systems, because the GME slots are controlled by the hospitals.
GME is graduate medical education is what the phrase means. So.
Okay, not seeing another hand. One more, yes.
Last year, Arizona fell to the 44th place for a child's overall well-being according to the Kids Count data book. All these new initiatives focus on bettering the lives of Arizona youth and increasing that number.
Yeah, well, so what I'll say is that's a central focus, exactly those kinds of findings. And so the health literacy program that we're talking about using, so ASU has built these unbelievable technological tools for educational outreach and educational enhancement. How do we get that information, those tools, ways for families to make better decisions, ways to educate moms on their kids, and people on their focusing on your question on children and children's health. How do we move beyond the model of a school nurse, as you wait until the child is sick, and then you send them to the nurse and you hope that somehow that's going to be the effective way of dealing with things. That's an inadequate model in every possible way. It's necessary but insufficient. And so one of the main things that we're doing is focusing on that exact problem. How do we ensure, and there's a way to measure this. So there's a way to measure health outcomes. You can measure health outcomes also by educational success. How many days are missed of school because of health issues? How many students are distracted from their learning outcomes because of health issues? How many people get off track because of health disruption in their families? And so our approach, exactly in the way that you're framing the question, is to look at that number. If we can't raise that number and raise that performance, then we have failed. And so our design is not just to produce people and throw them out into the market and see what happens. Our design is to produce people, to produce ideas, to produce new technologies, new systems, new tools, new ways of reaching and teaching, learning outcomes, all those things together. That's the approach of ASU Health in its entirety. So those are numbers we're very significantly aware of, and that's what we're focused on, which is a different approach than other organizations called health. Well, hopefully it would trickle into families having more information, schools having more information, being able to make decisions, being able to help get care to students at a time before something becomes acute. So how do you intervene quickly? How do you deal proactively? How do you deal with nutrition issues and so forth and so on? All those things. How do you help people to be healthier as kids? And it's mostly a function, not exclusive a function. It's heavily a function of information and learning, and that's what we're going to focus on.
And also a function of workforce, which is why we're here and why we thank you all for coming. Appreciate it. With this concludes the special board meeting, and we will resume our executive session. Thank you all.